Good morning, students. Today we are going to discuss the 12th cranial nerve. This is the hypoglossal nerve. Now, this hypoglossal nerve is the purely motor nerve meant to supply the muscles of tongue, that is intrinsic, all the intrinsic muscles and extrinsic muscles except palatoglossus. Now, what are the functional component of this nerve? That is the somatic efferent component is there only, which is the nucleus of which is lying in the dorsal part of the medulla, that is hypoglossal nucleus. Now, if we discuss the course, it has intracranial course and extracranial course. In intracranial course, the fibers, they start from the hypoglossal nucleus, they leave the brain between pyramid and olive, and they move towards the hypoglossal canal. In extracranial course, in the neck portion, once it is entering into the neck portion, this nerve is running between the internal carotid artery and internal jugular vein in initial part. Internal carotid artery is anteriorly and internal jugular vein is posteriorly. After that, this nerve is joined by the ventral root of C1. Now, what is the next fate of this nerve is that it is passing between the internal jugular vein and internal carotid artery and running downward, passing behind the posterior belly of digastric and styloid muscle. And after that, it is coming downward and loop around the occipital artery. Once it is looping around the occipital artery, it enters into the carotid triangle and crosses the internal carotid and external carotid vessels. Then loop around the lingual artery. So this is the lingual artery. Loop around the lingual artery and enter the digastric triangle to reach the floor of the mouth between hyoglossus muscle and the mylohyoid muscle. And running anteriorly, going towards the genioglossus, this nerve it divides into branches to supply the different muscles. So this is all about its course. In intracranial course, the fibers, they start from the hypoglossal nucleus, leave the brain between pyramid and olive, then move towards the hypoglossal canal. Once they are leaving through hypoglossal canal, in initial part, they are running between the internal carotid and internal jugular vein. Internal carotid artery is anteriorly and internal jugular vein is posteriorly. After that, it is joined by the ventral root of C1. And after that, this nerve is running between these two important vessels, that is internal carotid artery and internal jugular vein, passing behind the posterior belly of digastric and styloid muscle, then winding around the occipital artery, which is a branch of external carotid artery, and enter the carotid triangle. So in the carotid triangle, cross this internal and external carotid vessels and move forward to just wind around the lingual artery, which is again the branch of external carotid artery. Then enter the digastric triangle, and in the floor of mouth, it splits into different branches to supply the different muscles of tongue. So this is the course of this nerve. Now coming to the branches of this nerve. First is the branches of the nerve are, first is the muscular branches. I told you muscular branches, that is all the intrinsic and extrinsic muscles of the tongue except palatoglossus. So it supplies intrinsic, all intrinsic, clear, and extrinsic muscle. Is extrinsic muscle except palatoglossus. So what are the extrinsic muscle which are supplied by this? That is styloglossus, hyoglossus, and genioglossus. Second is communication through the ventral root of, communication with C1. So what are the branches given by it? That is the meningeal branch, then both the bellies of omohyoid, then is sternothyroid. Clear? Then is sternothyroid and thyroid. Sternoid. So these are the branches given by the ansa cervicalis. So there are another two branches, that is thyroid branch and genioid branch. So these branches are basically given. This is given once it is entering into the posterior belly, through the posterior belly of digastric, then winding around the lingual artery to enter into the digastric triangle. At that level, the thyroid branch is given. And genioid branch is given in the, you can say, once it is reaching or running in relation to the hypoglossal muscle. So these are the branches which are given by these, you can say, hypoglossal nerve. Basically, the hypoglossal concern is with this muscles of the tongue. These are the branches which are given by through its communication with the ansa cervicalis. So descending root, superior root of the ansa cervicalis is basically carrying the fibers of the hypoglossal nerve to supply the superior belly of omohyoid, thyroid and genioid. And but from the loop which is formed by the C1, C2 and C3, from that loop, this sternoid, sternothyroid and inferior belly of omohyoid, that is getting supplied. So this is all about the hypoglossal nerve. Now, if we want to check the integrity of this nerve, we just ask the patient or person to protrude the tongue. So once, if the hypoglossal nerve is affected, the protruded tongue move towards the affected side, because genioglossus is not that capable to pull the tongue towards its side. So that is the main basically differentiating feature, which to differentiate the facial nerve palsy and hypoglossal nerve palsy. So in hypoglossal nerve palsy, the deviation of the tongue, of the protruded tongue, it happens towards the affected side. So this is all about the hypoglossal nerve. So thank you very much.